Looksmaxxing, or to looksmax, is a practice involving several forms of body care routines in an effort to improve one's physical appearance. While the practice as a whole can refer to simple hygiene, more extreme methods have become associated with looksmaxxing, such as mewing. The practice is affiliated with incel subculture and originated on manosphere message boards. The practice became a TikTok trend and became popular amongst mostly teenagers in the 2020s. Looksmaxxing is a practice in which people perform several body care routines in an effort to improve one's physical appearance. Some of these practices are fairly common and standard, such as clearing up facial acne, going to the gym, getting a new haircut, or moisturizing. These practices are the most popular and are considered soft maxing. Additional practices have been associated with looksmaxxing, with a popular example being the act of mewing, which involves performing various exercises with your tongue with the goal of achieving a square jawline. These methods are the most popular ones shared around TikTok, where handsome men are typically the ones giving the advice. These methods were previously popularized with magazines such as GQ, Esquire, and Men's Health sharing around skincare and hairstyle advice. Some that partake in looksmaxxing consider themselves to be making facial gains. Some people who perform looksmaxxing have also performed more extreme methods. This has been coined as hard maxing, and those who practice them refer to themselves as hard maxers. Practices associated with hard maxing include getting implants or limb lengthening surgeries, intentionally starving oneself, starve maxing, using moisturizers to attempt to appear more white maxing, and withholding sexual climax in an effort to boost testosterone. Edging. Lastly, an additional method, known as bone smashing, refers to the act of hitting one's face against objects in order to create a chiseled look. While this practice is considered an inside joke and few have actually done it, it has been warned as misinformation. Some that partake in looksmaxxing also look for others to rate their appearance, with some engaging in anonymous message boards associated with incel subculture. This rating has been considered to be one's sexual market value. Those that determine this value usually check for a variety of different facial features. One of the most prominent features checked for is hunter eyes, which refers to a positive canthal tilt resembling that of a predatorial animal. Additional features checked for include hollow cheeks and pursed lips. In order to achieve these features, some perform acts such as the aforementioned mewing, rubbing against the orbital area, or even getting surgery. The looksmaxxing phenomenon to maximize one's looks is aimed at young men and boys who want to change their appearance to become more attractive and gain social acceptance. Unhappy with their appearance, teenage boys and young men scrolling the app are directed to chat rooms where they are instructed to upload photos in exchange for advice. It begins with soft maxing. This includes basic hygiene such as teeth brushing and whitening, removal of face and body hair, and mewing tongue exercises that supposedly help tone facial muscles. This progresses to hard maxing, which is to improve one's appearance by any means necessary. More extreme measures include steroid use, hair transplants and plastic surgery, using pumps for penis stretching, removing ribs for a sculpted waist, bone smashing, which involves using hammers to break bones in the face to look more masculine, starvemaxing, which encourages extreme dieting and eating disorders, white maxing, which involves using creams to present as more white, and edge maxing, which is described as withholding climaxing in order to boost testosterone to improve appearance. Looksmaxxing may appear harmless, encouraging self-care, exercise and healthy eating. But at its core it has ties to violence, suicide and incels, involuntary celibates, men who blame women for their struggles with establishing romantic or sexual relationships. John Mew, born in 1928, is a British orthodontist. He is the founder of orthotropics and mewing. Orthotropics is a form of oral posture training that claims to guide facial growth and is not supported by mainstream orthodontists. John Mew's son Michael Mew, born in 1969, is also an orthodontist and has also practiced and promoted the idea of orthotropics known today as mewing.
Mewing is a technique that some people claim can improve the aesthetic of the jawline. Mewing involves placing the tongue against the roof of the mouth while closing the lips and setting the teeth together. The supposed benefits of mewing include a well-defined jawline and improved alignment of the chin and nose. Anecdotal reports have also suggested that mewing can help resolve sleep apnea, breathing and swallowing problems, speech disorders, temporomandibular joint dysfunction, sinusitis. According to internet sites that support the technique, mewing is simply the placement of the tongue against the roof of the mouth. The whole tongue should be resting on the roof of the mouth, sitting between the molars. The advice is to keep the tongue in this position whenever the mouth is closed until it becomes a normal resting position. If holding the tongue in this position is new to people, they may find it tiring at first. Apparently, a person should feel mild pressure across the middle of their face, jaw, and chin if they are mewing correctly. All support for the benefits of mewing so far comes from social media sites, which have no expert regulation on the topic. Some articles and blogs have also warned of the dangers of becoming obsessed with mewing as a treatment technique. Mewing is not scientifically proven and may or may not provide the desired results. Some anecdotal evidence reports visible results within a matter of months, but most sites agree that it could take years for a person to notice results, if they ever do. Many social media mewing advocates are adolescents, whose faces and jawlines are likely to change naturally over the course of puberty, rather than as a result of this technique. There is no evidence to support mewing as an alternative therapy to jaw surgery or other scientifically backed face-shaping methods.
If you enjoyed this video and you would love to see more from us, please like and subscribe to this channel. Don't forget to comment your thoughts and share our video. Don't forget to check out our other videos too.
Teeth. Now as you close your mouth, press the tongue to the roof and lightly press. If done correctly, the double chin will lift up. Follow for more facial issues.